Hi, I'm Dr. Lauren Lam, and I practice in Calgary, Alberta, Canada. It was really neat. So it was covering the revolutionary technology that L'Oreal has in terms of creating skin models, Episkin as it's known, to basically be able to test their products as opposed to using it on animals. So I didn't know this. They've actually been doing testing on Episkin for over 40 years. So they're actually able to generate every layer of the skin, down from the bottom, the dermis, the epidermis, and even the stratum corneum. So they're able to personalize it, add pigments and melanin to create darker skin tones or lighter skin tones. And they're also able to make it grow, actually. So they showed a video where over a 2-week lapse, they're able to see the dermis actually create an epidermis and even the stratum corneum. So that was pretty cool. Yes. So they showed examples of using vitamin C on it. In this case, this talk was talking about sunscreen and the effects on DNA damage, inflammation, and cell damage, essentially. So what they did was they looked at a L'Oreal sunscreen and compared it to a really popular sunscreen that everybody probably knows about. And interestingly, this L'Oreal sunscreen had something called cell ox technology. So the cell ox technology is comprised of three things, two of which are antioxidants. One's derived from plants, and then a booster that helps the SPF to work better. So what they did was they took a look at those three components, looking at DNA damage, looking at inflammation, and also cell damage. And for each component, interestingly, they were able to prove that the L'Oreal sunscreen actually can prevent DNA damage. That was the one that really shocked me the most. There was actually no DNA protection for the comparator. So we do know that DNA damage can, of course, lead to skin cancers. So I think that's a new revolutionary way to think about sunscreen, is to think about the DNA damage and the sequelae and the mutations that can happen after that. They also mentioned that patients nowadays really want sunscreens that can do it all, or at least do multiple things. I know I'm a lazy girl. I'm guessing you probably would like something that does more than one job and is a multitasker. And so it's really interesting to be able to see how sunscreen formulations these days are not going to just block sunscreen, but can add moisture or can help with pigmentation or can help with acne. These things did not exist when I was a teenager, which is why I refused to wear sunscreen. And that's a major regret now as a dermatologist. But just amazing that we can have new formulations that not only are things that we like to use, but can also do more than just prevent skin damage and skin cancers. That is my number one question that I get asked by patients is, what kind of sunscreen should I be using? And which ones do you recommend? And I think it's a difficult question to answer because it really depends on what you're looking for out of your sunscreen. But I think the number one thing they want to know is it going to help? And is it better than other sunscreens? This is something they mentioned in the talk, was that there's still a lot of debunking to do. So I think generally people feel that having the best of both worlds, having something that is a combination, is probably best because it covers all spectrum of light. What they did highlight too is that at least in the US, there haven't been any filters that have been approved for long UVA. So the cell ox actually helps to address that a little bit because they did show that some of the deeper penetration was blocked and some of the DNA damage and inflammation, those were also reduced with the cell ox technologies.